everybody. Dr. Rafich here from Vet Triage. It's July 29th, 9:22 a.m. Pacific time. Sorry for the delay. The YouTube live stream thing was being weird, so we had to figure out why it wasn't functioning. But we're back. We're on. I think. I'm pretty sure. So we're going to talk about blood work and when you should consider blood work for your pet. Again, this pertains really to dogs and cats. I don't know how often reptiles, birds, etc. need it because it's so hard to get blood from those species, and you only take so much blood. So I don't know what the basis is. I presume for anything that's not a dog or a cat, at least once a year, blood work is probably recommended. And then when they get to geriatric age, probably twice a year. But we'll take our conversation to dogs and cats. So the most common time to get blood work, or the most commonly thought of time to get blood work, is during the routine annual examinations with your vet. So typically, regardless of how old your pet is, or rather the ones who are less than elderly or geriatric, it's once a year. So every 12 months, you get blood work done, and that blood work is typically a general screening panel. Usually, it's the first panel is checking liver and kidney function, that kind of thing. So that's called a chemistry panel or a biochemistry panel or a chemistry profile or just a chem, CHEM. And then the second panel you'd usually run along with the chemistry panel is a CBC or a complete blood count. And the CBC looks for white blood cells, red blood cells. And then depending on where you live and the veterinarian and what species you're talking about, typically a heartworm test is going to be recommended as well. The heartworm test is intended to see whether or not your dog is heartworm positive, and if they are, they aren't. That determines whether or not the veterinarian wants to refill your prescription for prophylactic heartworm prevention. And then beyond that, it kind of depends. It's a case by case basis. So, whether or not if you live in an area that's really tick infested, then perhaps every year you're doing routine tick blood work. But I would say for the most part, even in those areas like the northeast of the United States, typically they're only running tick panels if there's concern of infection, or you found a tick on your pet. But most of the time, the heartworm blood work and the tick blood work are combined anyway in a panel. So it usually, if you're in a high risk area for those diseases, they're typically run together anyway. But those are what I mean by typical blood work. There's also fecal analysis too. So you'd submit feces from your pet to see if there's parasites. And again, that kind of depends on how old your pet is, and it depends what your veterinarian wants to do and if you can afford it. But for puppies and kittens, they either consider mandatory or they just deworm. And if you're a young adult, then maybe doing a once a year fecal is fine. But beyond young adulthood, it's uncommon to see parasites in dogs that are more immune mature, and so it's typically not run unless there's a reason to do it. And then finally, urine testing, baseline urinalysis testing, or a UA, we abbreviate it. It can be done annually as well. That should be done as a routine evaluation. And typically you wouldn't combine the urinalysis with a urine culture. The urine culture looks to see if it can grow bacteria, to see whether or not your pet has a urinary tract infection. Not every patient that has a positive culture had an abnormal urinalysis. So if the veterinarian suspects your dog has a UTI, urinary tract infection, or if your dog is prone to having UTIs in the past, maybe your vet may tack on a urine culture in addition to the urinalysis just because. Otherwise, most vets will only run a urine culture if the urinalysis is suggestive of a infection. Those are your blood works. Now, if you're geriatric, and that depends on the species and depends on the breed, every 6 months, typically you're running blood work for those pets because older pets are prone to developing diseases. They don't always have to be sick from developing diseases, or maybe they're early on in a disease and you want to catch it as early as possible. So every 6 months for geriatric. And geriatric does depend on your breed. A Chihuahua may not be considered geriatric to like 10 years and above, or it's like a Great Dane or a Rottweiler, by the time it hit like 5, 6, 7 years old, they're considered geriatric. So it depends on that. And of course, cats are, maybe 10, 12 years and above. So anyway, those are your routine blood work. What are other times that you might run blood work for a pet? Well, if they're on medication that is known to either have potential long-term side effects, or if your pet's on medication that requires checking levels of that drug. So drug levels or drug concentrations, plasma levels, whatever you want to call them. And then you would do blood work more often. How often depends on the scenario. Depends on your pet, on your veterinarian, what drug your pet is on, how's your pet doing clinically and at home. And so you'd run blood work as a monitoring parameter for medication that's ongoing or long-term. The other time you'd run blood work for your pet, of course, is if they're sick, obviously, right? If they're sick, you're going to run blood work. And it doesn't matter if your pet was healthy a week ago and you got blood work done a week ago, but now a week later your pet is sick, you need to recheck new blood work because something could have changed. And it's actually good to do it that way because now your vet has a very recent baseline of when your pet was normal compared to the blood work now when your pet is sick. So I know it's expensive, it adds up financially, but it's worth it. So you'd run blood work in scenarios where your pet is sick, or your pet is injured, or your pet got into a toxicity or medication or poison of some kind. You'd run blood work and then go from there. And then finally, the other time you run blood work would be to evaluate the healing process while in the hospital. So if your pet got into something and now the liver and kidneys are injured from that toxicity, and your pet is now hospitalized, your vet will run blood work, not just at the time of admission to the hospital, but also on a routine basis thereafter while they're in the hospital. Maybe it's every 24 hours, maybe it's every 6 hours, depends on what the problem is they're looking to monitor at the vet. But regardless, you would be able to do blood work fairly routinely and determine whether or not the treatment is working and how the pet's body is progressing. So those are all the reasons to run blood work. I'm sure there are other more broad categories, like for example, you want to have a pet that's going to give blood for blood transfusion, right? They're going to donate blood. Well, then you have to run the blood work necessarily for that to make sure that you're not transfusing a sick dog with blood from a dog who's also clinically sick, right? If you're trying to get a pet out for adoption, like let's say, for example, cats, we typically do retroviral testing on cats. So that's the FELV or feline leukemia virus, FIV or the feline immunodeficiency virus, and there are other viruses as well in these panels that we will screen cats for, because not every cat that is positive for a viral infection can be adopted. Depends on what virus you're talking about, what's the short-term, long-term, what's that pet owner willing to do? If the cat is positive for some sort of infection, do they have other cats at home that are prone to getting this infectious disease? So we screen animals before adoption as well. We screen them with blood work. Hey, we have an audience member. Any questions, let me know. So those are all the times that you would run blood work on your pets. Obviously, there's large variability depending on the scenario for what your veterinarian wants to do and what you as a pet owner wants to do. But those are your standard stuff. Are there other blood panels? Absolutely. There's hundreds and hundreds and hundreds of blood panels you could run on pets depending on what disease you're talking about. Obviously, it goes beyond the scope of this live stream, but there's a ton. There are some that are fairly inexpensive by whatever standard you want to use. And there are some that are very expensive depending on, again, what standard you want to use. But your veterinarian will recommend stuff depending on the case, what's appropriate. And then your job as a pet owner is to decide whether or not you can afford it, and or whether you want to do it at all. So yeah, but that's I think that's it for today. Any questions, let me know. Thanks for those who watch on the playback. Feel free to subscribe and donate, share, hit like, all the good things. And I'll see you guys tomorrow, Tuesday. It is July 30th tomorrow. So we'll try to get a live stream in tomorrow morning, and I'll talk to you guys then. Take care.